Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Anti-infective drugs and topical agents. Corinne is experiencing diarrhea after consuming her prescribed antibiotics for the whole week. This is because Option A. The drugs render food indigestible. Option B. Gastric flora is disturbed. Option C. Fluid is added into the intestine. Option D. Normal intestinal bacteria are destroyed. Right answer is Option D. Normal intestinal bacteria are destroyed. The destruction of normal intestinal flora causes diarrhea. In choice A, a drug that rendered food indigestible could not be given because it would cause severe malnutrition. Choice B is incorrect because there is no gastric flora. Choice C is incorrect because there is no way to add fluid into the intestine. When a client with chronic obstructive pulmonary disease is taking theophylline also receives ciprofloxacin, Cipro, which of the following interaction could occur? Option A. Ciprotoxicity. Option B. Ineffectiveness of ciprofloxacin. Option C. Theophylline toxicity. Option D. Ineffective theophylline. Right answer is Option C. Theophylline toxicity. Theophylline toxicity may occur because the action of theophylline is increased when given with ciprofloxacin. There is no such thing as ciprotoxicity. The client at highest risk for nephrotoxicity with aminoglycoside use is A. Option A. Male with a creatinine of 1.7 and BUN of 52 on a 10-day regimen. Option B. Female with BUN of 12 and creatinine of 0.8. Option C. Female with past history of cystitis on 5 days of therapy. Option D. Male with history of kidney stones on 8 days of therapy. Right answer is Option A. Male with a creatinine of 1.7 and BUN of 52 on a 10-day regimen. Choice B is incorrect because a 24-year-old woman with a normal BUN and creatinine would not be at higher risk than others when given aminoglycosides. Choice C is incorrect because recurrent cystitis on limited-time therapy does not present a high risk for nephrotoxicity. The last choice is incorrect because a history of kidney stones on limited-time therapy does not present a high risk for nephrotoxicity. When assessing clients for evidence of a penicillin allergy, which of the following symptoms may not be considered to be a true hypersensitivity reaction? Option A. Wheezing. Option B. Nausea. Option C. Urticaria. Option D. Angioneurotic edema. Right answer is Option B. Nausea. GI disturbances such as nausea are usually caused by direct irritation or overgrowth of gram-positive bacteria or yeasts and are not indicative of a true penicillin allergy. All of the following symptoms are evidence of a superinfection except Option A. White oral plaques. Option B. Creamy vaginal discharge. Option C. Skin rash. Option D. Darkened tongue. Right answer is Option C. Skin rash. Skin rashes are indicative of hypersensitivity reactions in clients on penicillin therapy. Which of the following statements is true when educating clients about penicillin therapy? Option A. The client must take the medication at evenly spaced intervals. Option B. The client may save leftover medication for a future illness. Option C. If signs of an allergic reaction, continue the medication and notify physician. Option D. Clients taking oral contraceptives must be cautioned to use an alternate form of birth control while being treated with penicillin. Right answer is Option D. Clients taking oral contraceptives must be cautioned to use an alternate form of birth control while being treated with penicillin. Penicillin will reduce the effectiveness of birth control pills. Antonietta is taking antituberculars. The most common adverse effect she may be experiencing is Option A. Red-orange discoloration of urine. Option B. Hypersensitivity. Option C. Hepatotoxicity. Option D. CHF. Right answer is option C. Hepatotoxicity. Hepatotoxicity is the most common side effect associated with antitubercular agents. Orange discoloration is a side effect of rifampin but not with antituberculars in general. In treatment of tuberculosis, the therapeutic rationale for combination drug therapy is to: Option A. Decrease cost and improve compliance. Option B. Reduce the incidence of cumulative effects. Option C. Increase blood dyscrasias. Option D. Decrease emergence of drug-resistant strains. Right answer is option D. Decrease emergence of drug-resistant strains. Combination therapy helps decrease the emergence of drug-resistant strains. Multiple drugs usually increase cost and reduce compliance. Multiple drugs increase cumulative effects. Blood dyscrasias would be an untoward effect, not a desired effect. Changes in visual acuity and color perception are associated with treatment by which of the following agents? Option A. INH, isoniazid. Option B. PZA, pyrazinamide. Option C. ETH, ethambutol. Option D. SM, streptomycin. Right answer is option C. ETH, ethambutol. Ethambutol will cause changes in visual acuity and color perception. Remember E for ethambutol and eyes. Peripheral neuropathy is a side effect associated with INH. Gout is a side effect associated with pyrazinamide. Ototoxicity may occur with streptomycin. Which of the following groups of antitubercular agents includes first-line agents? Option A. INH, PZA, RIF. Option B. SM, PA, INH. Option C. EMB, PA, INH. Option D. INH, cycloserine, RIF. Right answer is option A. INH, PZA, RIF. INH, PZA, and RIF are used as combination first-line agents. Antitubercular therapy may be determined ineffective when: Option A. Sputums are negative. Option B. Symptoms resolve. Option C. Hepatitis results. Option D. Drug-resistant bacteria emerge. Right answer is option D. Drug-resistant bacteria emerge. The emergence of drug-resistant bacteria indicates that antitubercular therapy is ineffective because the drugs are no longer ending bacterial multiplication. Fluconazole, diflucan, can be administered to a client with: Option A. Pneumococcal meningitis. Option B. Oral thrush. Option C. Cryptococcal meningitis. Option D. Pneumococcal pneumonia. Right answer is option C. Cryptococcal meningitis. Fluconazole, diflucan, is a drug given for the treatment of cryptococcal meningitis. A and D are incorrect because pneumococcal meningitis and pneumonia are not caused by fungal infections. Oral thrush is treated with a more mild antifungal, such as nystatin. When administering amphotericin B, which of the following must be used? Option A. A brown bag to protect the infusion from the light. Option B. A diluent of 5% dextrose with no preservatives. Option C. A diluent of normal saline with alcohol. Option D. A micron filter of above LMU. Right answer is option B. A diluent of 5% dextrose with no preservatives. Amphotericin B must be mixed with a solution with no preservatives. The solution is sensitive to light but does not require the infusion to be covered. A micron filter should not be used. If unavoidable, it must be less than 1 μ. Which of the following nursing diagnoses might occur when administering large parenteral doses of amphotericin B with vancomycin, vancomycin? Option A. Decreased cardiac output. Option B. Ineffective airway clearance. Option C. Ineffective breathing pattern. Option D. Fluid volume excess. Right answer is option D. Fluid volume excess. These two drugs are both nephrotoxic, so this nursing diagnosis may result from renal problems. Avik, a 16-year-old student, has acquired systemic fungal infection. He should be treated with option A. Amphotericin B. Option B. Miconazole, Monostat IV. Option C. Ketoconazole. Option D. Griseofulvin, pulvicin. Right answer is option A. Amphotericin B. Serious life-threatening fungal infections are treated with amphotericin B. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.